The approaches that the Democrats in Congress and the President want to take is to improve Medicare. And it's already underway thanks to last year's health care law. Now, the House Republicans have a very different plan for the future. And it's one that's based on theory and not proven fact. Instead of improving Medicare, they would end Medicare as we know it by turning it into a private insurance company voucher program. The plan would wipe out the new benefits that many seniors are seeing by repealing the Affordable Care Act.
What the Republicans are saying, that this won't affect seniors now, that the cuts are all off in future years, is flat out false. As you know, in the reform bill that we passed, we solved over time the problem of the donut hole, the dreaded coverage gap that seniors fall into when their prescriptions can't be paid for any longer. That solution to the donut hole problem gets repealed by the Ryan budget, and that will hit home right away to seniors in Rhode Island and to seniors across this country.
When we talk about Medicaid, they make Medicaid sound like it's a bad word, that somehow it's a budget buster. They like to talk about big picture. Well, let's paint the picture. Medicaid primarily goes to paying the nursing home bills of old people who have either Alzheimer's, Parkinson's, or a dire incapacitating disease, and they don't qualify for it unless they have spent down a substantial amount of their life savings in order to qualify for Medicaid. And in families, young families are terrified about what they call the sandwich generation, where they pay for their parents' nursing home care and then have to pay for their kids' tuition for college. They shouldn't have to make that choice. We're not going to let them take away the only federal support there is to help people who desperately need a nursing home. You don't go into a nursing home because it's a lifestyle choice. It's because it's a lifestyle necessity, and we need to fight it.
Marlene from Franklin County wrote, "My sister was just told she has breast cancer. Thanks to the fact she has health insurance, Medicare, and supplemental as a retired teacher, early detection was possible. But what about the many poor women who won't have mammograms or breast exams or an early detection of life-threatening diseases or any kind of care if the Republicans can repeal the president's health care law? Please do whatever you can to prevent what feels like a war against women." The Republican budget, pure and simple, would pull out the rug from under our seniors to finance tax cuts for millionaires. It's as simple as that.
So, to me, the answer is, to follow the law. We got a law passed. The president signed it. It's really good. They're doing everything they can to dismantle it bit by bit. And I think our job is to make sure that we beat that back or that it becomes subject to the president's veto pen. This is a noble work, this Affordable Care Act. It's a noble work. It's got so much in it. I don't want to see 32 million Americans who don't have health insurance not get that health insurance, but that's what will happen if Ryan has the House has its way. I don't know how people can think like that, but they do, so we have to be ready to fight, which is why we're here.